The Sureglide Safety Scalpel has an elegant design that will feel familiar to surgeons, as well as safety features to reduce the risk of fetal lacerations and sharps injury to surgical staff. The Sureglide improves on first-generation safety scalpels with an ergonomically designed handle that is familiar in length and feel to traditional scalpels. Sureglide's unique tip offers superior protection against fetal laceration during the initial hysterotomy. The protected blade is designed to eliminate fetal exposure to the scalpel blade. Sureglide is optimized for safety, comfort, and physician control during the hysterotomy. Key design features include an ergonomic curved handle which mimics a traditional scalpel, raised ribs for improved grip, and a silhouette that accommodates different hand grip positions. Sureglide allows the surgeon to enter the uterus safely and quickly without the need for a traditional scalpel. During the majority of cesarean deliveries, the baby's face, cheek, and ear are at the highest risk of laceration. These are also the most noticeable baby features to the parents. Increased risk of laceration also occurs during emergency situations, at teaching hospitals, and with prolonged labors that thin out the uterine wall. Position the tip carefully so the protective edge is parallel to the uterine wall and the blade is facing up. Apply slight downward pressure against the uterine wall to initiate incision. Once the Sureglide tip passes through the uterine wall, slightly rock the device handle to engage the blade and direct the tip away from the baby. Continue the incision transversely. 1 or 2 fingers may be placed under the uterine wall to help guide the device and offer additional protection for the baby. If the uterine wall is thicker or a vertical incision is needed, multiple passes can be made safely with Sureglide. Once entry is made into the uterine cavity, the hysterotomy incision can be extended using Sureglide or with blunt manual expansion. While Sureglide has been thoughtfully designed to mimic the feel and comfort of a traditional scalpel, the technique used is slightly different. When using a traditional scalpel, the surgeon cuts towards his or her own body, making multiple passes regardless of tissue thickness. With Sureglide, the surgeon cuts away from his or her body with minimal pressure. The combination of Sureglide and surgical technique is unmatched safety. It provides you and your patient the confidence of a safe, efficient cesarean delivery every time. Sureglide, safer for baby, peace of mind for everyone else.